Hey, wealthy business family. Welcome back to the channel where we break down the latest in finance, business, and personal growth. I'm your name, and today we're covering a big story in the healthcare industry. The Federal Trade Commission, FTC, is suing three major U.S. health companies, UnitedHealth, CVS, and Cigna, over claims that they've been inflating insulin prices. Let's get into the details and what this could mean for millions of Americans. The FTC is going after the pharmacy benefit managers, PBMs, of these health companies, accusing them of using shady practices to drive up the price of insulin. PBMs are the middlemen in the drug supply chain. They negotiate drug prices with manufacturers on behalf of insurers and large employers and decide which drugs are covered by insurance. The FTC's lawsuit claims that these PBMs have created a perverse rebate system where they prioritize drugs with higher rebates from manufacturers. As a result, insulin list prices have been artificially inflated, and patients end up paying more, sometimes to the point of being unable to afford life-saving medication. Insulin prices have skyrocketed in recent years. For example, Eli Lilly's Humalog insulin had a list price of $21 in 1999, but by 2017, that price had jumped to a staggering $274, a more than 1,200% increase. This lawsuit doesn't just affect the big three PBMs, UnitedHealth's Optum Rx, CVS's Caremark, and Cigna's Express Scripts. The FTC is also looking into the role of major insulin manufacturers like Eli Lilly, Sanofi, and Novo Nordisk. These companies control 90% of the U.S. insulin market, and the FTC says they could be next in line for legal action. Millions of Americans with diabetes rely on insulin to survive, and the FTC argues that these inflated prices have forced many to ration their insulin. This is especially concerning when we know that insulin is a life-saving drug for people with diabetes, and price hikes put patients' health at serious risk. And while we're on the topic of reforms, this lawsuit adds to growing pressure from both the government and the public to make prescription drugs more affordable. According to the White House, Americans pay 2 to 3 times more for prescription drugs than people in other developed countries. Now let's talk about the impact on these companies. The PBMs are pushing back hard. A spokesperson for UnitedHealth said the lawsuit demonstrates a profound misunderstanding of how drug pricing works. CVS also responded, saying they're proud of their work in making insulin more affordable. And Express Scripts accused the FTC of making unsubstantiated claims. So, where does this leave us? The FTC's lawsuit is still in its early stages, but it could have far-reaching consequences. If the FTC is successful, it could lead to major changes in how PBMs operate and force drug companies to lower their insulin prices. It could also trigger broader reforms in the healthcare industry aimed at making prescription drugs more affordable. That's it for today's update. What do you think about the FTC's lawsuit? Will this be the change we need in the healthcare system? Drop your thoughts in the comments below. And as always, if you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more updates from Wealthy Business.